Now let us start with our second part, that is the factors affecting the venous return from the systemic circulation. So what are the factors which are affecting our venous return? Means venous return is also of course coming from systemic circulation, because from systemic circulation it will supply the capillaries, and from capillaries in turn it connect into veins. So from veins it comes. So let us see what are those factors. So first one we have the right atrial pressure. So you can see here right atrial pressure mainly exert the backward force on veins, because you can understand when the in the right atrium side, if the pressure is very high, because of this pressure the veins, it is hard for the veins to pump to the right atrium now, to impede the flow of blood from veins to the right atrium. So that's what we are saying. If in the, you can understand, if the pressure is in the, if in the right atrium the pressure is very high, then it is hard for the veins to come into this. So it will like impeding the back pressure towards the vein. And next one is the degree of filling of systemic circulation, that is which is mainly measured by the mean systemic filling, that is also mean systemic filling pressure, that is also called as PSF. Means the amount of filling of systemic circulation, this is measured by mainly mean systemic filling. So which force the systemic blood to the heart. So this mean systemic pressure is nothing but the pressure which is forcing the blood towards the heart, means it is forcing the blood to enter from the venous return towards the heart, that is the mean systemic pressure. Next let us see what is the resistance to blood flow between peripheral vessels and right atrium. So this is one more factor which is affecting the venous return, that is the resistance to blood flow between the peripheral vessels and right atrium. So you can understand from the right atrium and peripheral vessels, means from the left ventricle to peripheral vessels, that the resistance between them also may affect our venous return. And the cardiac output curve relates the pumping of blood by heart to right atrial pressure. And venous return curve, we have actually cardiac output curve, venous return curves, we will see them also. So actually these curves, so mainly cardiac output curve relates the pumping of blood by heart to right atrial pressure. To the right atrial pressure, it concerned about cardiac output curve. Whereas venous return curve is concerned about, it relates with the venous return also to the right atrial pressure, that is venous flow of blood into the heart from systemic circulation at different level of right atrial pressure. So this is mainly concerned with the venous return curve. So we are having two types of curve, cardiac output curve and venous return curve. So these are mainly dependent on this basis. So let us see what is normal venous return curve. So here you can see one of the curve. This is the normal venous return curve. So here you can see this is the right atrial pressure which is on our x-axis, and on y-axis we are having our venous return. You can see here right atrial pressure and venous return. So you can see our right atrial pressures are like till 8, and our venous pressures are between 0 and 5. So you can see first the plateau is formed, later the transitional zone is formed, and next down slopes means as our right atrial pressure is in minus degrees, it is in plateau, but whereas when it is coming from minus to positive, that is up to 0, then it is in transitional zone, that is the venous return is in transitional zone. But as our right atrial pressure is increasing like to +4, +8, then you can see venous return is slowly decreasing, it is showing a down slope. Means whenever the atrial pressure is high, right atrial pressure is very high. Here see, not arterial, it is atrial. Atria means right atrium, left atrium there, right? So if the right atrial pressure is very high, like about you can see +8, then at the time you can see there is a downslope in the venous return, because here the pressure is very high. So because of this pressure now venous return feels it hard to come to the right atrial side. So here you can see this is the mean systemic filling pressure at this +8. So at +8 where the venous return is very low to our right atrium, that is called as mean systemic filling pressure. So this is a filling pressure. Mean systemic filling pressure is that the pressure which forces the blood to move into the heart, because it is forcing now, because already the atrial pressure is very high. At this point, if the blood can means it is forcing the blood to go, because it's hard because of the back pressure which is created by a right atrial pressure. So this is the curve which explains a normal venous return curve. Now let us check out some of the theory part regarding our normal venous return curve. Just now we have seen it. So whenever the atrial, not artery here, that you need to check out because it may be mistaken. So atrial means right atrium, right? Especially when there is increase in atrial pressure to like about 7 milligrams of mercury, then there will be backup pressure increasing right to the venous side. So it reaches 0. Yeah, because on venous side it reaches 0 because already it is coming, there is lot of resistance given by this right atrial pressure. So now what happens? So now the heart can't pump the outcome to the equilibrium when flowing in a systemic circulation ceases. So now what happens? Now you can understand the venous return is decreased to the heart. As the venous return is decreased, of course our cardiac output will also affect. Even the cardiac output will drop. As the cardiac output will drop, you can understand now the systemic circulation is ceased because there is no circulation in systemic circulation, that is to atrial circulation, so that is also stopped. So at this point actually what happens, the venous pressure and the atrial pressure now gets equal. So at this pressure of 7, so the so this definition is mainly saying about, so this defines the, this is which by the definition is the PSF. So what is PSF actually? PSF is nothing but our mean systemic filling pressure. Mean systemic filling pressure means this is the case which is formed mainly when atrial pressure is very high and it is not allowing the venous return. So if there is no venous return, there is no cardiac output, the systemic circulation ceases. So when this PSF is in 7 millimeters of mercury, that is important. So now let us see the plateau phase. We have already seen in the diagram right here the plateau. So this plateau is mainly due to the venous return curve at negative atrial pressure. We have already seen it. When the atrial pressure is negative, we have got the plateau in the case of our venous return. It is caused by the collapse of large veins. Why the large veins are getting collapsed? You can see the word, the collapse of large veins. Why the large veins are getting collapsed? Because lot of pressure is coming from the right atrium now. So when the right atrial pressure is decreased to 0 or also may decrease to atmospheric pressure, then there is increase in venous return, then more venous return cease. Okay. So so you can see here transitional zone at plateau only. It's like somewhat hard situation for our venous side because already they are collapsing. But if the right atrial pressure is coming to 0, then what happens? It comes to transition. It is now very hard for the venous system. Like it is almost you can see here it's like almost ceasing. The venous return is ceasing now and the right atrium now is having 2 milligrams. Then the venous return reaches the plateau. Yeah, here it's not 2, it's -2 actually. So -2 means more dropping pressure. So more dropping pressure. In the dropping pressure, it is in plateau. It's like just simple to remember. When our atrial pressure is in positive, means completely a venous return is stopped. When atrial pressure is in negative, then the venous return is in plateau. That's it. Only this thing you need to remember. So this plateau is mainly caused by collapse of veins which are entering the chest. That is, the negative pressure in the right atrium sucks the walls of the vein and prevent the flow of blood from the peripheral veins. And negative pressure in the right atrium won't increase the venous return. That's it. So the mean circulatory filling pressure, the mean systemic filling pressure and their effect on the venous return. So now let us see one more 2 parameters, that is our mean circulatory filling pressure and mean systemic filling pressure and their effects on venous return. So when the heart stops for, you think as a situation when the heart stops beating for few seconds by any kind of pathology of any kind of abnormality without the blood flow, all pressures of circulation become equal. Of course, in all systemic circulation or peripheral circulation, anywhere on venous side or atrial side, the pressures of circulation will be equal, and that is called as mean circulatory filling pressure. So we have got now one more parameter. Before we have seen mean systemic filling pressure. We have understood what is mean systemic filling pressure. It is mainly because the venous return is not coming to heart because of higher pressure in the right atrium. Now we are going to see one more parameter, that is mean circulatory filling pressure. What is this mean circulatory filling pressure is when our heart stops, for example, because of any other condition, then all blood pressures which are present, are equal, if all blood pressures are equal, that is called as mean circulatory filling pressure. So here the increase of volume of blood lead to increase in mean circulatory filling pressure. If the volume of blood is increased, then it is also increased. So it is shown by actually a red curve. So here you can see this red curve. This is showing the. So next, at the volume of blood like about 4000 milliliters, the mean circulatory filling pressure is almost like close to zero because it is unstressed volume. So in unstressed volume, then circulatory filling pressure is zero because already 4000 ml of volume of blood is present. So but at the case of 5000 milliliters, the mean circulatory filling pressure is the normal value of like 7. So even we have seen that mean systemic filling pressure is also having a value of 7. Even this mean circulatory filling pressure is having a value of 7. So if there is higher increase in volume of blood, then there will also be higher increase in the mean circulatory filling pressure linearly along with this. So by this we can say that the blood volume is directly proportional with our mean circulatory filling pressure. And sympathetic nervous system increase the mean circulatory filling pressure, that is green and blue curves. So here in this curves mainly you can see this green and blue curves are shown by sympathetic stimulation. Yeah, so when our sympathetic nervous system is there, you can see how high, how steep the curves are. Because of sympathetic stimulation, the mean circulatory filling pressure is also increased. So sympathetic nervous system, constrict all vessels. So now when sympathetic nervous system is activated, actually all vessels are constricted. So there is also increase, again further increase in mean circulatory filling pressure, because if vessels are constricted, blood pressure is increased. So like actually its normal value is 7, right? From 7 it is increasing 2.5 times, like it is getting 17 millimeters of mercury because of this mean circulatory filling pressure. Because of the sympathetic nervous system which is constricting the vessels. And also if inhibition of sympathetic nervous system takes place, then all vessels get relaxed and the mean circulatory filling pressure decreases from 7 to 4 milligrams of mercury. Now let us now let us check out the relation. Now we have understood what is mean systemic filling pressure, and also we understood what is mean circulatory filling pressure. Once again let us revise because it's somewhat different terms. Mean systemic filling pressure means because of higher pressure in right atrium, venous return is not able to come inside. This PSF, its value is 7. Even this MCFP means mean circulatory filling, this is also 7 value. But why this is called? When all pressures of circulation are equal, this is caused then. So now let us see how these both are related. So actually this PSF, that is mean systemic filling pressure, here the pressure in the systemic circulation after the blood flow is stopped by clamping the large blood vessels like veins, we know. So here PSF is equal to, so the formula is PSF is equal to MCFE though. So this is not a formula, it's like they're saying like nearly both are equal with each other, that is mean systemic filling pressure is equal to the mean circulatory filling pressure, but just nearly, not exactly. So the normal mean systemic filling pressure PSF is 7. So if increase in PSF or tightness, if PSF is increased means increase in tightness, we know, because more tighter to go into the right atrium. So this increases the venous return curve to that is more venous return curve shift upward and towards the right. So shifting more upward and towards the right. So in this graph we can see that. So you can see that the PSF, that is mean systemic filling pressure, is 14, means it is very high. So when it is very high, the graph is moving towards upward, you can see like this, upward, and also it is moving towards the right side. And next, whenever this PSF is decreases, then the curve shift downward and towards the left. So you can see here the PSF is like very low, so it is moving downwards and also towards left side. And when the right atrial pressure is like increased and equal to PSF, then there is no longer pressure difference between the peripheral vessels and also right atrium. So decrease in right atrial pressure lower than PSF, then the flow to the heart will increase, of course, because decrease in right atrial pressure, as you know, as there is low pressure, now the venous return can increase, so the flow of heart to increase, and greater difference between the PSF and right atrial pressure, then when the greater becomes the venous return. So difference between two pressures is mainly called as pressure gradient for venous return. So PSF represents the pressure pushing the venous blood from periphery towards the heart, and resistance to the vein increase, that is the blood begin to dam up. If the resistance increase, then the blood begin to dam up in the veins and blood flow to the right atrium is decrease, of course, if it is backup pressure is more. And arterial and small artery resistance increase. If the resistance increase, of course blood accumulate in the arteries, and pressure and rise in pressure like about 30 times, that is 2/3 of resistance to the venous return is determined by venous resistance. Once we'll check out the graph. So you can see this graph here, the venous return curves showing the normal curve with the mean systemic filling pressure is 7. This is the normal curve, and the effect of altering PSF to either 3.5 you can see or 14, the modified. So whenever 3.5 how it is, whenever it is 14, you can see here from normal to difference. And here now we are going to see what happens when half of the resistance is given. You can see here the right atrial pressure, venous return when normal resistance, and when 2x of resistance is given. So if 2/3 of resistance is given, so actually this graph what it means is if the right atrial pressure and venous return, if they're having more pressure difference, for example here you can see this PSF, that is systemic filling pressure, is 14, whereas here on the graph you can see here like about plus 12. So you can see plus 12 plus 14, they're having the difference. Because of this difference you can see the venous return is increased like about greater than 10, and next you can see here the PSF is 7, whereas here it is like between 4 or so because of this is a normal, because PSF 7, even here it is 7, so normal. But here you can see the PSF is 3.5 and it is like near 4, and the venous return you can see here how it is increased. So that is what they're saying, that is the greater the difference between the PSF and the right atrial pressure, the greater becomes the venous return. So therefore the difference between these two pressures is called a pressure gradient for the venous return. So actually what this graph says is decrease in resistance to 1/2. You can see here the resistance is decreased, 1/2 decrease in resistance allows twice as much of blood flow and therefore rotates the curve upward to twice as great as slope. So you can see here upward to as great as twice of slope because of decrease in resistance of 1/2. And next we have increase in resistance to twice. You can see here 2x resistance means if the resistance is 2 times increase in resistance to twice, then normal rotates the curve downward to 1/2 as greater slope. So you can see the curve is downward, and this is nothing but what it says is if the resistance is more, then the arterial blood pressure is low if the resistance is high. So you can see here the actually this is representing the right atrial pressure. So right atrial pressure gives the resistance, right? So if the 2x the resistance, then the venous return will decrease. See, this is the venous return side. Say if resistance is 2 times, means you can see this green one is indicating that it is having lower venous return. If only half resistance, means only some resistance when compared with 2, it is like okay, half resistance. So because of this half resistance, you can see the graph is like upward, like it is between 10 to 15. So the venous return is increased. So this is what saying between the resistance of right atrial pressure and the venous return to it. So this is how they are related. So here also again you can say according to the resistance. So this red line says that normal resistance. In normal resistance it like in 7, right? So it's also here 7. But you can see 2 times of resistance. You can again understand if the this green line, the resistance is more, then the venous return will be low here. So it's see just below, like between 0 and 5. But half the resistance, you can see this blue line is tremendously increasing as the resistance is only half. So now here the venous return is maximum, whereas you can see also the black line, that is 1/3 resistance. So because of 1/3 resistance is also like this between this 5 and 10 values. So now let's try to understand this graph. Here you can see this red line actually represents the normal cardiac output, and this blue line represents our venous return to our heart. So this A point is where the cardiac output and venous return are meeting. So this point is an equilibrium point which states that at which the venous return is equal to the cardiac output. So you can see at the time where the venous return is equal to the cardiac output, we already know this, how much venous return comes to the heart. The same thing goes with the cardiac output. and at which the right atrial pressure is same for both heart and also systemic circulation. Yes, of course. So therefore, in normal circulation, the right atrial pressure, cardiac output, venous return, all are depicted by this only point A. So this point A is called equilibrium point, giving a normal value of cardiac output like 5 liters. So you can see point A is exactly at 5 liters of total cardiac volume and the right atrial pressure of 0. So here also you can see the right atrial pressure is 0 over here at A. If I draw, I can see here the cardiac output is 5 and the right atrial pressure is 0 at point A. So this is what depicting about this graph. So you can see the two solid curves demonstrate on analysis of cardiac output and right atrial pressure when the cardiac output red line and the venous return blue line curves are normal. Transfusion of blood equal to 20% of blood volume causes the venous return curve to become dashed curve. As a result, the cardiac output and right atrial pressure shift from point A to B. So this is the point B. This is dashed line here. This dashed line is also venous return. And PSF mean systemic filling pressure. So now let us try to understand this graph. So here this red line is again our normal cardiac output and our venous return. So here you can see different points actually. Here because of sympathetic stimulation what happens, and because of sympathetic inhibition what happens to our cardiac output. Let us see. So first you can see this point A is a normal point where our cardiac output is 5 liters we know and the right atrial pressure is 0 we know. So because of sympathetic stimulation we have seen this green line. This green line is maximum sympathetic stimulation. So because of this the cardiac output is like increasing about like 25 liters per minute and the PSF value of here is like plus 17, and you can see here this point is meeting at D. So now the cardiac output is increased from A point to D, that is it has doubled from 5 to 10 liters because of a maximum sympathetic stimulation. Whereas by the moderate sympathetic stimulation you can see it is coming to point C, like in the cardiac output will now be between the 5 and 10. Whereas because of spinal anesthesia means sympathetic inhibition. So because of sympathetic inhibition you can understand, come to this dotted line B, means now the cardiac output is decreased, like it is between 0 and 5. And of course in every situation here the right atrial pressure is constant, it will be like 0 or it will slightly increase, but almost it's like 0. So you can see how because of stimulation our cardiac output is increasing, and because of depression like sympathetic inhibition how it is decreasing. So yeah, we have completed all the graphs. Now just remaining small theory part. So venous return we have formula like PSF minus PRA. PRA means here right atrial pressure by RVR. RVR means resistance to the venous return. So here in the normal person the values of RVR, that is venous return is 5 liter we know, and PSF is 7 we know, and PRA right atrial pressure 0 we know from our graph we already seen, and RVR is the resistance to the venous return is like 1.4. This is a new value which we don't know. So if we substitute this we can get the answer of our venous return. Like this is a formula, so if any of the value they're missing they'll ask you to find out. So let us see what are the factors which are affecting the venous return. So muscle pump, like where muscle contraction forces the venous return to heart, and it is aided by unidirectional venous valves. And changes in intrathoracic pressure like include right atrial pressure, respiratory pump. During inspiration the abdominal pressure is increased due to downward movement of diaphragm, while the intrathoracic pressure is decreased because of increase in thoracic volume. So the pressure gradient from abdomen to thorax favors the return of venous blood to heart, and the resistance to blood flow between the peripheral veins and right atrium, and the blood volume, posture, PSF, sympathetic nerve activation. So all these are the factors which are affecting our venous return. So venous return is equal to cardiac output into so venous return is equal to cardiac output and right atrial pressure. Same for the heart and the systemic circulation. So if there is increase in blood volume like 20%, then there is increase in cardiac output like about 2.5 to 3 times of normal. So if PSF is increased to 16, the curve moves towards the right, and at point B it is equal to venous return increases 2.5 to 3 times, and the right atrial pressure rise to positive 8 milligrams of mercury. So compensatory effect in response to increase in blood volume, like increase in cardiac output, increase capillary pressure, return blood volume to normal, and increase in pressure in vein cause veins distancing by stress relaxation, causing venous blood reservoirs like in spleen, liver to distance or reducing the PSF, And increase in blood flow by peripheral tissue cause autoregulatory increase of peripheral vascular resistance, like increase in resistance to venous return, and all this cause the PSF to return to the normal and resistant vessels of sympathetic circulation constrict. So therefore, over a period of like 10 to 40 minutes, the cardiac output returns almost to the normal. So the last one is the effect of sympathetic stimulation of cardiac output. So sympathetic affect both the heart and systemic circulation, that is increase in pumping, increase in PSF because of contraction of peripheral vessels, especially in veins, and it increases the resistance to venous return. Whereas the effect of sympathetic inhibition on cardiac output is sympathetic system is blocked by total spinal anesthesia or by drug like hexamethonium, and also blocks the transmission of nervous signal by autonomic nervous ganglia. So decrease pumping like 80% to normal decreases, and decrease to about like 60% of normal cardiac output. Already, if we inhibit the sympathetic nervous system, the cardiac output decreases. If we activate the sympathetic, cardiac output increases. So measuring of cardiac output. So we have different measures like our electromagnetic method, ultrasonic flow method, which is placed on aorta, pulmonary artery to measure the cardiac output. We also have our oxygen fick method, and also we have the indicated dilution method, ECG, all these measures. So we know already, just recall this formula: cardiac output is equal to stroke volume into heart rate. So pulsatile output is mainly measured by the electromagnetic and ultrasonic flow meter, and if the blood flow is increased in the peak of the systole, later reverse flow causes the aortic valve close and flow to return to 100. And oxygen Fick's principle says that, for example, if by this diagram you can understand Fick's principle. You can see on right side we are having 160 milliliters going into our lungs and coming out as 200. Then what is the change? 160 is going but 200 is coming, means how much is added? 40 is added. Why 40 is added? Because of, you can see, oxygen, 200 ml of oxygen by lungs is used for every liter of blood passing through it. So you can see 160, 40. So 1 liter of blood is using 40, means total 40 into 5 you can take like 200. So 200 milliliters is reached. So total 5 liters of blood. So this gives us the cardiac output. So you can understand that 5 liters of blood passing through this gets the 200 ml of oxygen from the lungs and finally comes out from the left heart as 200 milliliters. So this is what Fick's is saying. Fick's principle says that how much amount of blood is going to right heart from the right heart, it is coming from the left heart by taking some extra oxygen. So by that we can measure the cardiac output. So you can see right heart oxygen 160 and 200 is coming, the blood leaving the left heart. So 200 minus 160 if you do, we get 40. So each liter of blood absorbs 40 ml of oxygen. So you can say 200 by 40, we get 5 liters of blood. So the 5 liters of blood pass by the lung each minute. So cardiac output is equal to the oxygen absorbed per minute by lungs by arteriovenous oxygen difference, that is like 200 minus 160. So you can get 20 by 40 is equal to 5 liters. So send catheter to find oxygen concentration. Even we can send the catheter to sometimes find. So here we are using Fick's principle. You will send catheter. Catheter, it's actually sent by large veins from our body, or else you can also send it by means of any big artery. So by this we'll send first into the right atrium, from there into right ventricle, from there into pulmonary circulation, from there again into left atrium, into left ventricle, and also systemic circulation. So this catheter now can find out the oxygen everywhere in our circulation system. And next we have our indicator dilution method. So indicator dilution method, here the indicator is nothing but dye. So here what we do, same like the catheter, instead of catheter now we will send the dye. So now what this dye will do, because of sending of this dye, we will see wherever the color is going on. So by this we can understand that how much amount of oxygen is present. So here we are injecting to a large vein, or from large vein it will go into the right atrium, and next into left atrium, again left system and systemic circulation. So here we use 5 milligrams of cardio green dye injected at you can see injected at 0 time. By this graph you can see first it is injected at 0 time, later at some time, after some time it get diffused in the circulation, so it reaches the peak. So this is how the graph is formed, you can see here. So extrapolated time gives us, by this we can calculate the mean concentration of dye in arterial blood for the duration of curve. So So cardiac output is equal to milligrams of dye injected into 60 by average concentration of dye in each millimeter of blood for calculation of curve into duration of curve in second. So this is a formula. So actually the last bit has become fast because our video is getting too much longer, but it is like an easy part. Once again, if we check out the textbook, we can easily understand, but successfully I completed that graphs which are like headache to me. So okay, that's it about this cardiac output venous return. Next we will move on to our next chapter, that is our regulation of cardiac output.